Ethical considerations and patient counseling in assisted reproductive technologies, ART. The use of assisted reproductive technologies, ART, including techniques like in vitro fertilization, IVF, intracytoplasmic sperm injection, ICSI, and pre-implantation genetic testing, PGT, has raised significant ethical concerns that must be addressed in clinical practice. Patient counseling is essential to ensure that individuals and couples fully understand the ethical implications, make informed decisions, and are supported throughout the ART process. This overview discusses the ethical considerations in ART and the importance of patient counseling. 1. Ethical considerations in ART. A. Informed consent. Informed consent is a cornerstone of ethical medical practice. In ART, this involves providing patients with clear, comprehensive information about the risks and benefits of ART procedures, e.g. IVF, ICSI, PGT, success rates, including the likelihood of a successful pregnancy and live birth, potential complications for both the mother and the child, e.g. multiple pregnancies, ovarian hyperstimulation syndrome, emotional and psychological risks, including stress and anxiety associated with ART, long-term outcomes for children born through ART. Key points in informed consent for ART. Consent should be voluntary and free of coercion. Patients should be able to ask questions and have all their concerns addressed. Written consent should be obtained, ensuring that patients understand the procedures, including any potential ethical dilemmas, e.g., the use of donor sperm, egg donation, or embryo hand freezing. B. Embryo disposition. One significant ethical issue is the disposition of unused embryos after an ART cycle. Options include embryo freezing for future use, embryo donation to other couples or research, embryo disposal, long-term storage of embryos, which may raise concerns about the moral status of embryos, especially regarding whether unused embryos should be discarded. Counseling considerations. Patients must be informed of their options and the ethical implications of each choice. Ethical beliefs about the status of embryos should be respected, and patients should be given space to make decisions that align with their personal, cultural, or religious values. C. Genetic testing and selection. The rise of PGTA, PGTM, and PGTSR in ART brings about questions related to genetic screening and embryo selection. Ethical concerns. Designer babies. The concern that genetic testing could be used to select embryos based on non-medical traits, e.g., eye color, intelligence. Discrimination. Potential for discriminatory practices in selecting embryos, e.g., selecting embryos based on sex or genetic traits considered undesirable. Equity. Access to genetic testing and ART may be limited, raising concerns about inequality and discrimination in healthcare. Counseling considerations. Patients should be made aware of the ethical limits of genetic testing and the risks of overinterpretation or misuse of genetic information. Discussions should emphasize the importance of informed, autonomous decision-making while respecting the patient's values and preferences. D. Surrogacy. Surrogacy presents complex ethical issues, including the rights of the surrogate mother and the intended parents. Ethical dilemmas may involve exploitation of surrogate mothers, especially in cases where financial compensation is involved. Legal rights and parental rights after the birth of the child. Psychological impacts on the surrogate mother and the child. Counseling considerations. Clear contracts and legal agreements should be in place to define the roles and responsibilities of all parties involved in surrogacy. Patients should be made aware of the emotional and psychological complexities of surrogacy, including the potential for emotional attachment and the surrogate's rights. E. Gender selection and reproductive autonomy. In some ART settings, gender selection may be possible through genetic testing, e.g., using PGTA for sex chromosome analysis. While not universally available, it raises ethical questions. Sex selection for non-medical reasons, e.g., choosing a child's gender to balance a family, is controversial. Cultural and societal implications. Gender selection could perpetuate gender-based discrimination and inequality. Counseling considerations. Counsel patients on the ethical implications of gender selection and its potential consequences. Respect for reproductive autonomy should be balanced with the discussion of societal consequences. 2. Patient counseling in ART. A. Understanding emotional and psychological impacts. ART can be an emotionally taxing process. Patients may experience stress, anxiety, and frustration due to the uncertainty of success and the physical and emotional demands of the treatments. Counseling considerations. Provide psychological support before, during, and after ART procedures. This could include referrals to fertility counselors, psychologists, or support groups. Prepare patients for the possibility of failure, miscarriage, or the emotional toll of multiple IVF cycles. Offer coping strategies to help manage the stress and disappointment that can arise during ART treatments. B. Managing expectations and decision making. ART procedures often do not guarantee success, and patients need realistic expectations about the chances of success based on their age, fertility history, and the nature of the ART procedures. Counseling considerations. Discuss the success rates of ART procedures, IVF, ICSI, etc., for different age groups and underlying infertility issues. Provide information about alternative options, such as the use of donor eggs, sperm donation, or embryo adoption in cases of recurrent ART failure. C. Ethical decision making in ART. Ethical dilemmas in ART can be complicated and emotionally charged. Patients may face difficult decisions regarding the use of donor gametes, eggs or sperm, embryo disposition, what to do with unused embryos, e.g., cryopreservation or donation, embryo screening for genetic abnormalities, counseling considerations. Encourage patients to explore their values and make decisions that align with their ethical, cultural, and personal beliefs. Provide support for couples in navigating complex ethical issues like embryo selection, surrogacy, and genetic testing. D. Informed consent in ART. Informed consent is essential in ART, and patients need to fully understand the procedures, risks, and potential outcomes of their treatment. Counseling considerations ensure that patients understand the risks and benefits of ART. Ensure that patients provide informed consent for all procedures, including PGT, ICSI, and embryo freezing, after being fully informed about the potential consequences. Document consent and decision carefully, respecting the autonomy of the patients. 3. Conclusion. Ethical considerations in assisted reproductive technologies, ART, require careful attention to patient autonomy, informed consent, equity, and psychological support. Effective patient counseling can help patients navigate the complexities of ART, make informed decisions, and manage the emotional and psychological challenges of infertility treatments. Counselors, clinicians, and fertility specialists must be equipped to discuss and address these sensitive issues while respecting the cultural, ethical, and personal values of the individuals and couples they serve.